Welcome. Thank you for joining us today. I am Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Cancer Center series, a special collaboration between the Blum Center and the Cancer Center at Mass General. Before I get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has mutes from our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. I'll type them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. So next, I would like to introduce you all to today's guest speakers. Joining us today, we have Cheryl Brunelle and Babz Tobin. Cheryl has been a physical therapist at Mass General for just over 20 years and the Associate Director of the Mass General Breast Cancer-Related Lymphedema Research Program for 10 years. She is a physical therapy clinical specialist and certified lymphedema therapist. She splits her time between patient care and her lymphatic research, frequently presenting the team's research at national and international conferences. Cheryl is currently collaborating with multidisciplinary teams to update national and international lymphatic guidelines. Babz is an occupational therapist at Mass General. She is also a lymphedema therapist, certified yoga teacher, and Reiki master. Babz is passionate and eager to create and collaborate on holistic wellness programs to support individuals through their cancer journeys and beyond. She is the founder of Lymph Flow Yoga, a type of yoga specifically designed to improve lymphatic health, which she was inspired to create to help her mom, who is a breast cancer survivor and has lymphedema. Cheryl and Babz joins us today to give a talk on breast cancer-related lymphedema. So please join me in welcoming them.
Thank you so much. I'll go ahead and share my screen if that's good, Amy. Okay, so welcome. Cheryl and I are very excited to present to you all today. So I see many of you are already here. So we'll have some time at the end of the presentation for a little Q&A. So feel free to write your questions in the chat. But today we're going to talk about breast cancer-related lymphedema and self-care. And thank you, Amy, for that introduction. So today's agenda, first, Cheryl will be starting and she'll be talking about our screening program at Mass General, also any updates in lymphedema research and clinical practice. And then I'm going to guide you through Lymph Flow Yoga, which is a practice that I've created. So we'll talk about the 4 components, the benefits, and then we'll actually engage in a chair flow class. So just as a little disclaimer, Cheryl and I are both lymphedema therapists and occupational therapists and physical therapists, but we might not be your therapist. So this presentation is really just intended to educate and inform and entertain, I hope, but not to provide individual medical advice. So Amy was so kind to introduce us, but this is a little bit more about us here that you can read at your own time, or I know this will be recorded as well. So we both are therapists over at Mass General, and we're both, you'll come to find out, very enthusiastic about the breast cancer community and supporting our lymphedema patients. So this is us.
Babz, sorry to interrupt. Do you mind putting your the slides in presentation mode right now? We can only see the cover titles slide.
It should be in presentation mode. I'll try it again. Let's see. Full screen. Did that change it? Is that in full screen now?
Yes,
Looks good
good.
now. Yes.
Okay, did the exact same thing as before, but as per usual, the internet always has some way to, to change and humble us. So I'll pass it over to Cheryl, who will now discuss our screening program.
Great. Thank you, Babz. It's a pleasure to be here today. Thank you to the Blum Center for inviting Babz and I here to speak. We are both very enthusiastic about breast cancer-related lymphedema. It's kind of our world at work. So it's a pleasure to be here. There are so many positive changes happening in the lymphedema world right now. It's literally exploding in terms of patient care and research. So I'm excited to just briefly share a few little updates today with you about our world here at MGH and beyond in terms of lymphedema. Next slide, Babz, please. Thanks. So for those of you who may not be aware, we have a lymphedema screening program here at MGH. This is specific to breast cancer. I would like to expand this to other types of lymphedema of other etiologies as well. This program's been in place since 2005. It's the largest of its kind globally, and it was actually the first screening program like this. Luckily, many facilities are now screening for lymphedema, which really helps us identify this condition earlier, get patients the treatment that they need at an earlier time, and therefore have better treatment outcomes, not the least of which is trying to maintain quality of life throughout survivorship. So we have screened just about 9,000 women. And through our screening program, our research program, and our care program here, we successfully attained the Lymphatic Education and Research Network Center of Excellence designation in 2023. So we know the benefits of screening include educating patients and increasing patient knowledge, and hopefully thereby decreasing fear of lymphedema, treating earlier, diagnosing earlier, and also lower costs. Breast cancer and its treatment are exceedingly expensive, and we're currently very interested in looking at the financial toxicity of breast cancer and lymphedema treatment amongst our screening population, but lower costs for both the patient and the patient's family and for our system. On the left side here, this little Venn diagram really shows how we think about lymphedema diagnosis. We incorporate what the patient's feeling or symptoms, what we are seeing. Babz and I will do, full clinical exam on patients who need it, who are referred to us for early lymphedema. We educate our patients. We talk about risk of progression and risk factors. But central to this is really what the patient's doing when she's not with us, taking care of herself at home, screening for progression at home, and those kinds of things. So it's quite a holistic program, and I would love to expand this beyond breast cancer as well at some point in the near future. Next slide, Babz. Great, thank you. For those of you who have been handed guidelines over the years as you've had lymphatic treatment or lymphedema treatment, you may see that the dates on those guidelines are rather old. The National Lymphedema Network guidelines are from 2011, 2012. The Lymphology Association of North America guidelines were from 2006. So with research exploding as it is, which is wonderful, there are more papers published in the last 2 years than there ever have been in terms of lymphedema and lipedema, which is just where we should be. So that has allowed us to really come together as a multidisciplinary team and update guidelines. So in the fall of 2023, I was lucky to be invited to a global research summit in St. Louis, and there were patients there, providers, lymphedema therapists, researchers, and scientists, all sitting around the same table discussing where we are in terms of the evidence and how we update these guidelines. So these were just published in the Journal of Medical Oncology in the past 2 months, and they cover a range of topics, including diagnosis, measurement, treatment, lymphatic surgery, which is really up and coming and evolving over the past decade or so, risk in terms of risk factors and risk of progression of lymphedema, and what we need to do next. There's still a lot of work to be done in terms of research. So what we need to do next. There is a QR code here on the screen for you, and that will bring you right to the set of papers in the Journal of Medical Oncology. And if you're interested in that and can't use the QR code for whatever reason, we're happy to provide that after today's session. Next slide, Babz. Thank you. Finally, this is really exciting because until this year, patients who had Medicare had no coverage for compression. And as those of you who wear compression know, it's exceedingly expensive and needs to be replaced every 6 to 12 months. So the Lymphedema Treatment Act was finally passed and made into a federal law on December 23rd, 2022, and it became coverage in January 1st of this year. So I also include a QR code here that brings you right to the Lymphedema Treatment Act. And this final rule coverage summary here on this page is also included there. But essentially, day garments, night garments, any type of bandaging supplies or accessories are now covered at 80%. In terms of how often they're covered, daytime garments are covered 3 sets every 6 months. And when we say 3 sets, we mean 3 sets for each body part. So if you wear a glove and a sleeve, that would allow for coverage for 3 gloves and 3 sleeves every 6 months. In terms of nighttime garments, it's 2 sets every 2 years. And bandaging supplies, there's no limit. And we know in terms of doing decongestive therapy, sometimes we need to do several sets of bandaging supplies for patients. So this falls under the Part B of Medicare. So the annual Part B deductible and 20% coinsurance do apply. And in terms of other Medicare plans like Medicare Advantage or other types, out-of-pocket costs may vary, but your lymphedema therapist can certainly help you call and understand coverage and can talk through that with you as well. But I think this is it's a fantastic change. This Lymphedema Treatment Act was in the works for over a decade. And it's just an amazing change to finally have coverage. And we are now seeing commercial payers who historically didn't cover falling into line with Medicare coverage. We would like to see this higher than 80% coverage. So we can continue to work with Medicare as they align their coverage yearly. I would encourage you to go on the Lymphedema Treatment Act website, which is here in the QR code, or we can provide it afterward. There's a spot where you can make your voice heard and share your experiences. And this was really paramount in helping to pass the Lymphedema Treatment Act. If everyone can share their experiences in terms of lack of coverage, it's extremely helpful. So just a few exciting updates in the world of lymphedema. There is lots more to be done. But without further ado, I'd love to give Babz time to share her Lymph Flow Yoga. All yours, Babz.
Thanks so much, Cheryl. Yeah, this is really exciting about the compression garments. It's coverage that we've never seen before. And I think what Cheryl said, it's strength in numbers too. So the more that we can advocate for our patients, if you're a healthcare provider, and that you can advocate for yourself, it just helps to shine light and awareness of lymphedema in general and the need for coverage. So thanks, Cheryl. So now we're going to talk about what Lymph Flow Yoga is. So I'm curious to see if any of you here have engaged in this practice before, maybe with me or on my YouTube channel. So maybe write in the chat if I know you or if you're familiar with this type of practice, just so I can get kind of a sense of who's here. But Lymph Flow Yoga is a type of yoga that I created as a self-care tool to provide to both my mom and my patients. So during the pandemic in 2020, all the outpatient clinics shut down. So I needed a way to provide really necessary education and guidance for my patient because I wasn't able to physically be with them. So I started my YouTube channel, Balance with Babz, and it kind of has grown ever since in the last 4 years. So I took my education as a lymphedema therapist, as an occupational therapist, and as a yoga teacher, and kind of meshed them all together to create this practice. The focus really is to help to balance your energy and to help to improve your lymph flow throughout your lymphatic system. So over here in this picture is my mom, and you can see lymphedema management, as many of you probably know, it takes a lot of different ways, so some people really enjoy rebounding or aquatic therapy, going in the pool, wearing their day and night garments. And yoga, I feel like, is a really helpful, beneficial tool that you can do daily that's very accessible and adaptable and just helps you to encourage your mind-body healing and essentially just help to promote your lymphatic health to help you manage lymphedema. So it's really beneficial for everybody. I know I benefit from practicing every day, but it is super important for our cancer community, lymphedema community, and lipedema community, and those who have some type of disruption in their lymphatic flow. It just helps to encourage and improve the drainage and help you to kind of better learn and understand your body. So there are 4 major components, and in each class we engage in these 4 components. So the 4 components are self-manual lymph drainage, which we'll do today. Breathing exercises, diaphragmatic breathing is very important to help to pump and help to encourage central lymphatic drainage. I'll teach you specific yoga sequences or forms that help to promote lymphatic drainage. So we start with proximal, so we start closer to the body and work our way to the distal part of our body so that we can help to encourage lymphatic drainage throughout our limbs. Today, we're going to focus on breast, chest, arms, and upper body. And then there's always some type of mindfulness meditation aspect, because I really feel like in order to heal, we must feel what's going on and really kind of be in touch with how our mind and body are communicating and that connection that we can form or reform. So I know a lot of you who are here might have been affected by breast cancer, so sometimes that causes a disruption in the communication between your mind and body. So a lot of our practice is encouraging that self-love, self-care, and rewiring of the connection between the mind, body, and soul. So there's so many benefits, and I think that everyone probably experiences a different benefit depending on where you are in your journey of your recovery or where you are in your treatment. But the main benefits that I've heard from my participants, from my patients, from my mom, and from those who have taken my classes, that it helps to promote this fluid balance. So the lymphatic system, one of its major roles is to create fluid balance in the body. But if you had lymph nodes removed, an area radiated, that's going to affect the lymph vessels, those little rivers and the pathways to be able to balance and move the fluid out of that area. So by engaging in this practice, it helps you just to encourage and help to train the body or retrain the body to move the fluid. It helps to ease physical and mental tension. A cancer diagnosis, any cancer diagnosis, is super stressful, and having an outlet or a way that you can de-stress and bring yourself back down to a stable and grounded state is really necessary in your healing and really promotes the inner healing. This practice also helps with your range of motion. So oftentimes shoulders might be affected, elbows might be affected, wrists from maybe axillary web syndrome like cording or different things that might come with the breast cancer diagnosis or the lymphedema diagnosis, that this practice helps to improve the range of motion, to help to work your muscles, work your joints, your tendons, your ligaments, everything to get the fluid and get your body back in motion. Also helps with strength and flexibility. And a lot of my participants, when they first start, we'll do some chair yoga and they'll be like, this is nothing. You know, I used to do handstands on the ground. I used to do all kinds of yoga on the ground. But starting square one is sometimes helpful because you can always build from square one. You know, you can always start small and see what's manageable. And then you, in a safe, comfortable environment, can see, oh yeah, I can lift my arms up now. I can move my body now. And kind of building on that confidence and snowballing in a positive way is really necessary when you may not have been very active lately, or, you know, your cancer treatments and your life has been shifted or altered. So coming back to that kind of square one of building yourself back up, I think is very helpful when you're recovering. This practice promotes education and awareness of the lymph pathways. So in all my classes, I talk about where is the lymph fluid going? Where are these lymph node clusters? What's going on? How can we help it? We do self-manual lymph drainage with skin-to-skin contact. So this will help if you are cleared by your doctor and you are now able to touch your scars and mobilize and help the tissue in those areas. So it helps to desensitize, because oftentimes when you have surgery in an area, that area, the connection between that area and your brain is going to be cut. You know, it's this area that's potentially has had some trauma and some pain and tenderness. So relearning your new body and kind of coming back to yourself and touching that area for the first time can be really therapeutic, and low and slow is definitely my motto. So just go easy, and I find that the more my patients and my participants are in touch with themselves and literally in touch with themselves, it helps to again build that confidence and desensitize. And I think above it all, this practice in our virtual community helps to promote accountability and reduces isolation. So your path or your lifestyle or your work, you may not be able to express the things that are going on with you, but in a community like the Blum Center has, and also my community online, it's people that really understand what's going on and it can help to support you better. So ultimately, this practice, I hope, is a self-care tool that helps to give you back a little bit of the control to help to promote health and wellness in your everyday life. So even just a few minutes of self-care, of breathing, of doing the lymph drainage, of doing the yoga poses, that's gonna, like I said, build in a positive way so that you can regain that control and have something to look forward to and something to help you to build yourself back up in a safe and comfortable way. So where can you practice? So I'm super excited to share with you that every first Wednesday of the month at 12 o'clock, we have a live in-person chair class at the Blum Center. So this is the QR code on the left here. And then I have a YouTube channel with, I think, now almost 700 videos somehow. I don't know how, but that's YouTube Balance with Babz. And this will bring you to my website just to show you or teach you a little bit more about the practice, a little bit about my mom and I's story. But the YouTube channel is completely free, and I have it categorized for Lymph Flow Yoga for mental health, for physical health, wrist free. So if you're having difficulty with pressure on the wrist, there's a whole channel or a whole playlist for that. Also, I recently have a playlist of Fit Me In flows. So I've been hearing from my community a lot that we just need a 10-minute practice. We just need a 20-minute practice to fit in our busy lives. And also maybe for attention spans and for whatever the reason may be, sometimes those shorter practices, again, will get the ball rolling in a positive way that doesn't feel overwhelming. So yeah, again, my kind of goal or purpose or hope for this practice is it's nourishing and rewarding, and that it's not overwhelming, because everyone knows we all have a lot on our plates. So I think, or I hope, that Lymph Flow Yoga is just a way to implement this into your daily routine. So oftentimes my patients will say, well, when should I do this yoga, or when should I do self MLD? And it's really wherever you can implement it into your life. So for the self massage, maybe before or after you shower, or before or after you go to bed, so that you can, when you're changing, so that you can get that skin to skin contact. So again, we'll do a little sample practice today, and it will be recorded so you can do it again. But I hope that you enjoy it, and I hope that you take some positive vibes from this presentation of the good news in our lymphedema world, and that this is a nice self-care practice for you. Okay, so let's flow. So I also want to mention that if you have restrictions from your doctor, so you had surgery last week and your provider said do not lift your arm past 90 degrees, respect those orders. They are from your doctor. And so if I lift my arms all the way up, you can stay in this 90 degree, or maybe skip it for today and come back next week when you're cleared, or the following week. So that's really the main contraindication, is if you have any range of motion restrictions. And also if you have an active infection that needs active care, so something like cellulitis where you need to go get treated immediately, you might not want to do yoga at this time. You might want to get help. So besides that, it's a very adaptive, accessible practice. But I would say listen to your body. I always like to say, listen to the whispers so you don't have to hear the screams. So listen to that inner voice saying, oh, that feels good. Okay, I can go a little bit more. Or if that voice says, oh, that kind of hurts, back off. So this practice is a lot about respecting your body, because I think if you can have respect for your body, then you can really start to learn and grow and heal from the inside out. So we'll begin. We'll do about a 20 or so minute flow, and then we'll come back for a Q&A. But I hope that you all enjoy. And yes, Benny is here, so you will see my four-legged friend running around. So I'm going to stop my share here, and then we can begin. So as a quick reminder, there's 4 components of every lymph flow yoga practice. The first is self-manual lymph drainage. The second is breathing exercises. The third is our actual yoga poses. And then the fourth is our mindfulness. So we'll begin with just grounding and centering ourselves, and then we'll engage in a self-manual lymph drainage warm-up routine. So I encourage you, and this is Benny, I encourage you to come to the edge of your seat. That way you can lift up a little bit taller, place your feet down to the earth, widen the feet a little so you have a nice space of support, and you can place your hands in your lap. And then feel free to close the eyes or just gaze down at the earth. And then in this moment, see if you can just relax your shoulders as you sit up a little taller. Softening your face and your jaw. Just noticing how you're breathing in this moment without trying to change or manipulate the breath just yet. Just notice. Is your breath shallow or deep? Is it slow or fast? Maybe by taking a moment to pay attention and turn your intention towards your breath, you start to slow it down. Maybe it's the first time all day you've stopped to just notice your breath, something that automatically happens throughout the day. The breath is a really awesome tool that we can use to our advantage to help us to feel different ways to balance our energy. And then we'll slowly take a breath in through the nose for a count of 3. Exhale, blow the air out for a count of 5. Breath in for a count of 3. Exhale, let it go. Slow breath in and out. Good. And then we'll place our palms together in heart center, just connecting the palms, the fingertips, relaxing the shoulders down. And then I'll encourage you to set your own intention for today. So maybe something that you'd like to achieve a little bit more of, maybe self-love, self-care, confidence, joy, ease, whatever it might be. Just think of something that you'd like to manifest into this space and into your own being. And then we'll inhale, reach our arms all the way up, stretch the arms up, gaze comes up, and then hands come down through heart center. We'll take a few more like that. Inhale, we'll spread and lift. If the shoulders are talking to you today, just come forward and in like this. Inhale, lift up. Exhale. One more time, breathe in and out. And then we'll begin our self-manual lymph drainage warm-up routine. So in your entire body, you have around 700 or so lymph nodes. A majority is in your abdominal region, and then the second largest area is in your neck and chest. So with that breathing, that helps to stimulate and encourage some movement here. And all that fluid gets filtered by lymph nodes and then comes back into the bloodstream right here at these major ducts behind your clavicles. So we start here because this is our major drain. So if you think of a bathtub that's filled with water, in order for that water to move out, you have to open up the drain. So stimulating here at the chest is essentially like opening that drain. So there's a couple ways we can do this. You can take your hands and cross the chest like this, so the hands are nice and flat, but sometimes that doesn't work in your anatomy, so maybe you want to just do one hand at a time, coming right here at the sternal notch where the clavicles meet. But if your hands are here, or the one hand, we're going to just gently stretch the skin in towards the neck. About 5 to 10 pumping skin stretching circles helps to encourage to wake up the lymph nodes above and below the clavicle, and also get the lymph vessels stimulated here at this major drain. The pressure is light. It's just like a skin play. You're just moving the skin. And also skin to skin contact is key, because if you go over your clothing, you're just going to slip and slide. You really want to grab and move that skin. So that's point 1. Point 2 is going to be at the neck. Couple options here. You can cross your hands like I am and just drain that fluid down to the collarbones. You can do this one hand at a time, creating these little half circle like movements. Option 3 is the heels of the hands connect, and you can stretch like this. So see what feels better. The more that you do this, you'll find a little groove of your own. And don't get discouraged or down on yourself. You're stimulating, you're stretching your skin, you're doing it right. You're fine. But so this is our second area. Third, we're going to come to the shoulder collectors here. So hands to the shoulders. Again, one hand at a time is fine. We're going to stretch the skin of the shoulders. So I'm bringing my hands back and in, and as I do this, I'm going to pump my elbows up and down. So when you're doing this, you're helping to stimulate the movement of the lymph fluid underneath the shoulders as well. Good. And then we'll take it to each armpit. So hand under one armpit, you can lift your arm up like this, or the hand can be down. And you're just going to pump in towards the breast. So hand nice and flat. And you're just going to pump towards the breast. About 5 to 10 times. Something I like to do too is get a little shoulder movement with the pumping. So more bang for your buck. You're getting that skin stretch and the muscle contraction. Good. And then the other side. So you're just pumping here. I love it. Boy. And you can move the shoulder. Good. And then release the hands down for a moment, just relaxing the hands. And then we're going to take our fingers like piano fingers, and we're going to bring them to our sternum. And we're going to gently kind of walk up and down. This is helping to lymph here up there. Just walking up and down. And then we'll inhale, sweep the arms all the way up, stretch up. Hands come down to heart center, and then we'll bring our hands to our rib cage here. And we're going to create some. It's coming in circles. Benny has a lot to say. So this is helping up through the lymph nodes, the lymph vessels here. Stretch. And then coming to the hip bones, we're going to pump here. So some circular pumping, breathing. Release our hands down. So that's our manual lymph drainage warm up. We did our neck, our shoulders. Inhale, reach the arms all the way up, stretch up. We're going to bring the hand across the lap to the left leg. up through that left arm, and then nice and slow side bend here. Breathing here. For those channels to move in. Feel the breath coming in and out. Take another breath in, opening up. And then exhale, roll the wrist all the way down. And then bring right arm up, left arm comes across the body to the right knee. Inhale, opening up the chest, and breathing in and out here. Soften through the face. It's getting gravity to help move the fluid. And then slowly roll the wrist coming all the way down. Facing up, reaching all the way up. Exhale, push the walls away. All the way up. Push the walls away. One more time. Breathe in, lift forward and up. Exhale, let it go. And then hands to the thighs. We're going to drop our chin down towards our chest. Close our eyes. Feel the stretch in the back of the neck. And then slowly begin some gentle neck circles. If you get dizzy during doing this, you can just gently look over one shoulder and then the other. So just gently moving the neck, breathing as you do this. Soften through the face and the jaw. And then reverse the circle. Breathing in and out. Then coming back to center, we'll lift the arms, shoulders up toward the ears, back and down. So making some nice movements. You can swim the arms with this. So shoulders up, back and down. Finding a big chest and heart opener. The more that we can move and expand through the chest, helps to improve lymph drainage here. Good. And then inhale, sweep the arms all the way up, stretching up. Exhale, hands come down to heart center, bringing hands into the lap. And then inch your way forward. And then we're going to inhale, draw our chin and our chest forward for seated cat and cow. Exhale, round and tuck. So from the side, it looks like this. You're inhaling, you're pulling forward, opening up the chest. Exhale, round and coming in. Few more like that, going at your own pace, breathing in to open. Exhale. This is a really good one if you sit for a long periods of time throughout the day. Breath in and out. Slow breath in and out. And then we'll sit up nice and tall, widen the legs a little bit more, and we're going to draw our body over one knee, center, left knee, and back and around. So you can allow the head to relax with this movement, just breathing in and out. Notice the stretch throughout the hips, the side body, and then reverse, go in the opposite direction. It's going nice and slow, letting your body just move and breathe. And then hands connect to the thighs. Sit up nice and tall. We're going to draw the left hand forward on the thighs. We bring the right hand palm back to the hips, so a gentle twist. Inhale back to center, and then exhale, twist to the other side. Breathing in, center. Exhale, twist. Breath in and out. Breath in and out. One more time each side, taking this at your own pace. And then back to center. Inhale and reach those arms all the way up. Hands come down through heart center, and we're just going to find some mobility through the wrists. So gently moving the wrists. Maybe getting a little pump on the fingertips on the back of the hand if you have back of the hand swelling. And then we're going to do something that helps to promote lymph fluid movement in the hand and the forearm, something called tendon glides. So we're going to take our hands flat like this to start. This is the first motion. The second is going to make a claw-like position so that the fingertips connect with the base of the palm. The next position is going to be like a duck beak, or we call it half fist or flat tabletop. So it looks like this, like a little duck beak. And then the next one is the half fist, so fingertips come down to the palm. And then the next one is full fist. I'll come a little closer. So first is straighten fingers, claw, or duck beak, half fist, full fist. Straight, claw, duck beak, half fist, full fist. One more time. Straighten, claw, duck beak, half fist, full fist. These are called tendon glides. And what they do is help to promote tendon movement through the hand to pump that fluid. Also really good for arthritis to helps to move the fluid in the hands. And now let's reach the arms up. And then with the arms overhead, we're just going to pump the hand. So this is helping to contract the muscles, also helping gravity to move the fluid. So taking a few more moments, just pump, pump, pump. And then reach those arms up. Imagine you're holding a beach ball overhead. Widen the legs. And then we're going to inhale here. Exhale, draw that beach ball over towards the right, down towards the earth, over towards the left, and up and around. So imagine you're finding a big circle, this ball of energy just moving. One more time in this direction. And then reverse, going in the opposite direction, nice and slow. We'll inhale as we reach up. Exhale as we slowly come down. Nice breathing in and out. One more time, breath in and out. And then reach the arms up, stretch the arms, lengthen through the legs. This is called our 5-pointed star. So really take up space in this world that you deserve. And then lower the arms, let everything settle. Bring the legs back. And then we'll slowly come into our final pose here. We'll do a spinal twist. So we'll inhale, reach the arms up. Exhale, twisting towards the right. That right hand comes behind you on the chair, left hand to the leg. Inhale to sit up nice and tall, and then exhale, slowly twist. Take a slow breath in to sit up tall. Exhale, twist. One more breath in. Let it go. And then inhale, reaching both arms up. Twisting to the left. Slow breath in to lift up nice and tall. Exhale to twist. Breath in and out. One more breath in and out. And then inhale, reach the arms all the way up, stretch up. Hands come down through heart center. And then you can find a nice comfortable position in your chair. where we'll spend the last few moments of our practice for our mindful meditation. So ease yourself, find comfort, hands into the lap, and you can close your eyes. Relaxing the shoulders away from the ears. As you take your next breath in your mind, say, I try my best. Exhale in your mind, say, and I release the rest. Inhale, I try my best. Exhale, and I release the rest. Allow your physical body to be supported by the earth, by the chair, by all of us here. One more time. Inhale, I try my best. Exhale, and I release the rest. Feel a wave of healing, of balanced energy move through you. Send a sense of gratitude to your physical and mental being for engaging in this practice today. Feel your body be still and ready to balance your lymph fluid, balance your energy. Have a wonderful day ahead. We can wiggle our fingers and toes, and then inhale, reaching our arms all the way up for the last time. Hands come down to heart center, and we can bow to one another to share our gratitude for one another. Thank you all so much for practicing with me and for being here. And we'll save some time now for some Q&A. And sorry that Benny is a little menace.
Thank you so much, Babz. This was wonderful. We are now at the end of the session, so if you have any questions for Babz or Cheryl, feel free to enter them in the chat. There are a couple of questions, and I know, Cheryl, you helped address one of them, but maybe perhaps it could be something that's beneficial for everybody. Let me just find it. This was regarding coverage for lymphedema garments and accessories. Is this only for lymphedema? How about lymphedema?
Yes, so currently the Medicare coverage and rule is only for lymphedema. However, some patients with lymphedema also have an element of lymphedema, so they would establish coverage. This is an area that requires further work. So I know the group at the Lymphedema Treatment Act, this is first and foremost in their minds to come back to CMS, the Center for Medicaid and Medicare Services, and work on this as the guidelines evolve in establishing. We must establish coverage for those with lymphedema as well.
Thank you. And are you able to provide information regarding Medicare coverage?
Yes, so the QR code was on the screen as well, but I can get the link up as well while we're finishing the Q&A. I don't think you put the link up, Amy, right?
The second one, the Lymphedema Act summary.
You did. Yes, you did.
So that's in there. So that's in there, as well as a link to the 2023 Lymphedema Summit. Both links are in there. So feel free to visit those websites for more information.
Yes, so the final coverage rule, so the summary of coverage that I presented is right at that link for you.
Thank you, Cheryl.
Of course.
And we have a question for Babz. When doing the circular motions, do we need to go clockwise or counterclockwise?
I wonder, circular motions of the wrists or the body in general, it really doesn't matter. Whatever you do, I would just do the opposite as well. So, I think you're probably talking about the manual lymph drainage, actually. For the physical poses, do both. For the manual lymph drainage, honestly, Cheryl, maybe you agree, but I think as long as you're stimulating, you're stretching the skin, you're still achieving that stimulation to that area, so it doesn't matter which direction the circles go.
Thank you. And I see a number of compliments of Benny's special appearance. Everyone loved his appearance.
I didn't. I did not. Usually he's such a good boy and will like eat his bone, but today he's excited. But I agree with the comment. He's living his best life. Yes, I would like to come back as Benny. But
And how often would you say would it be beneficial for someone to practice lymph flow yoga?
I think wherever they can fit it in their life, I think a little bit goes a long way. So, and it doesn't have to be specifically my videos, but even if you do a little on the edge of your bed, a little lymph drainage before you get up for the day, or so I think any bit is helpful.
Thank you. And you'll see in the chat that I also provided the link to Balance with Babz website. So why don't we give it another minute to see if there are any additional questions. While we wait, are there any final thoughts you'd like to share with the audience?
Sure, yeah. I think the main thing is that no, you're not alone. I think that a cancer diagnosis can be very isolating and hard, but know that you have organizations like the Blum Center and many virtual and in-person support groups that that can help you and help you navigate your care, and that Cheryl and I are here for you too. And yeah, just know that you're not alone, and there is support for you, and there's a lot of people going through exactly what you're going through. Not saying that's easy, but it definitely, I think, helps to know that you're supported.
And I would add that I think, and Babz, I know you'll agree, but many of our patients are at a point in their life where time is the hardest commodity to come by. They're taking care of children, they're taking care of parents, they have jobs that are demanding. It's really hard to find time. And Babz really practices what she preaches, which is lovely, which is taking that time out for a bit of self-care. And these things are so important as you're negotiating through survivorship with all of these side effects, just to try to get that into your schedule, even if it's, to Babz's point, 2 minutes, if we can start somewhere.
Absolutely. Well, I think that's all the questions that we have today. So I think it'd be fine to end a few minutes early. Cheryl, Babz, thank you so much for spending the hour with us. And for everyone who joined today, thank you so much. Hopefully you found today's session helpful. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, they'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Take care.
Thank you.